I'm Joanne Sanchez. Welcome to our first orthopedic educational community program, Your Active Life. We'd like to thank Affectionate Home Care for helping make this program possible. For the next 30 minutes, I will be alongside Dr. Raul Marquez, an orthopedic surgeon who has been in our community for the last 15 years. Dr. Marquez is well known and very well respected, both nationally and internationally in the medical communities. Dr. Marquez? Hi.
Hello, Joanne. I'm Dr. Marquez, and I'm an orthopedic surgeon. I just want to thank you for being with us today.
Our goal during this program, Your Active Life, is to educate and provide you with some valuable orthopedic information.
We'll be discussing in a series of programs the main orthopedic problems with the sports medicine, problems with joints and bones, as well as in general the treatment of pain management.
Dr. Marquez, what is orthopedics?
Orthopedics is a subspecialty of the medicine in which we treat the most common problems, mostly related to arthritis, as well as sports medicine, as well as the treatment of the pain in general.
We believe that this valuable information will help you make important decisions for you and your family, and ultimately enjoy an active life. Dr. Marquez had the opportunity to meet with some people from our community that asked him very interesting questions on common bone injuries. Let's take a look.
Yes, doctor. I hurt my knee in a car accident about 2 years ago, and it's been bothering me. And when the weather gets cold, it hurts even more. What's causing that?
Well, after an accident and you still have pain on your knees several years, if I remember correct your question, the most common cause of pain after an accident could be a damage of the articular cartilage. And I just want to pinpoint here, this is a model of the knee, and this is the articular cartilage, which is the cushion between the thigh bone and the leg bone. If you still have pain after an injury, the most common cause, like I told you before, is damage to this lining of the bone, which is the articular cartilage. Normally, when we have damage of this part of the knee, that means we have arthritis. It's not arthritis because of your age, but it's what we call a post-traumatic arthritis. Post-traumatic arthritis means damage of the cartilage because of the trauma, because of the injury to the knee. So if you're still having pain after that, the most common cause, as I told before, is because you have damaged, you have injured the articular cartilage. Usually the treatment for this is normally a little bit of medication, like anti-inflammatory medication, exercises. Most of the time, this is something that it will improve. It's not going to be a damage that is going to be for the rest of your life. But also, if the symptoms continue, like in your case, I will consult your doctor or see an orthopedic surgeon for that.
The idea that exercise makes arthritis worse is a myth. In fact, the opposite is true. Exercise stimulates the cartilage and absorbs nutrients and repairs itself. Choose the right, low-impact exercises like walking and swimming and make them your daily routine.
What is your question? Doctor, I've been kickboxing for about 8 years now, and I've never had a problem with my knees until it's been about a year now. And what happens is during my workout, I'm fine. It's after my workout. I start to develop, if I'm doing a really hard workout, days after, they just hurt. So if I'm sitting down at the computer, I'm working, I'm sitting down for a long period of time to get up, I have to kind of stretch and get them warmed up because they hurt. Is there a reason for that? Am I getting old?
No, really, you're not getting old. One of the problems that we have in that type of injury, like in kickboxing or biking or jumping, is a lot of pain around the kneecap. The pain around the kneecap, and again, we're going to go back to the illustration that was mentioned before, is this. This is the kneecap. This is the kneecap, and the kneecap acts like a pulley on the joint. One of the problems that you have is pain, like you mentioned, around your knee, around the kneecap. And what you're telling me is that you have pain mostly after exercising or when you sit for a long period of time. This is what we call an aisle syndrome. Aisle syndrome, the only thing it means when you go to a movies or the theater, you like to sit on the aisle and you want to keep your knee straight. If you keep your knee straight, you relieve the pressure between the kneecap and the thigh bone or the articular cartilage of the femur. That's what we call chondromalacia. And chondromalacia is just a big long term, which means damage of the articular cartilage around the kneecap. That's what we orthopedic surgeons talk about in those terms. But it's nothing bad. It's something that it can be improved with exercises, with anti-inflammatory medication, and also modifying some of the activities that you're doing. You're probably kicking too fast, you're probably squatting too much, and that's what is damaging the articular cartilage. So you're not getting old. This is an overuse syndrome, and I think the more active you are, the stronger your muscles are, the better you're gonna do with your knee.
We're here at the leg extension machine, and we're going to be focusing on the knee, the muscles around the knee. In order to do that, you're going to go ahead and place the cushion at the highest degree, and we're going to go ahead and isolate each leg. So we're going to go ahead, this leg is going to be slightly, if not bent, and it's going to be going up and down to focus on the muscles around the knee, just like Joe is doing right here. Notice, straight, down, straight, up. And again, this is going to go ahead and build the muscles around the knee.
Thank you once again for being with us. We sure hope that this information will help you make important decisions for you and for your family.
Thanks, Joanne. And I want to thank everybody for being in this program. I just want you to remember that this is an educational program and for information only. Hopefully this will be very helpful for you and your family, but if you have any specific questions, please call your doctor or you can call us at the office. Thank you again.
We'd like to thank Affection Home Care for helping make this program possible. I'm Joanne Sanchez alongside Dr. Raul Marquez. We'll see you here next week.